I am a doctor. And there are surgeries, common surgeries, surgeries that are recommended to seniors just like you every single day in this country that I would never recommend to my own father. Not because the surgeons aren't skilled, they are, but because the science, published in the most respected medical journals in the world, shows that for your body, at your age, these procedures often leave people worse, not better. In a moment, I will show you exactly which surgeries I'm talking about and the simple alternatives that often work just as well. But if you don't understand the specific reason why these procedures fail in a body over 65, what I'm about to tell you won't make sense. So stay with me, because the next few minutes could save you from years of pain, and they could save your life. Hi, I'm Dr. Sarah. Welcome to the Senior Health Podcast. If you're new here, I'm a geriatric specialist, and I started this podcast because I believe your pain has been dismissed, minimized, and ignored for far too long. I want to tell you about Harold. Harold was 69 years old, 32 years on a factory floor, the kind of man who built things with his hands. After retirement, the one thing that kept him going, his one true joy, was his woodworking shop in the garage. Rocking chairs, birdhouses, little toys for the grandchildren. That shop was Harold's whole heart, until the back pain started. Harold went to his doctor. His doctor sent him to a spine specialist. That specialist looked at Harold's MRI and said, "You need spinal fusion surgery." Harold was nervous. He asked if he could try physical therapy first. The surgeon looked at him and said, "Harold, if we wait any longer, you could end up in a wheelchair." So Harold said yes. 6 months after that surgery, Harold couldn't stand for more than 10 minutes. The woodworking shop sat cold and empty. He couldn't lift his granddaughter. He couldn't sleep through the night. And the pain the surgeon had promised would be gone, was worse than before the knife ever touched his back. Harold sat across from me and said, "Dr. Sarah, I feel like they took everything away from me and gave me nothing back." But then I discovered something, and everything changed. I'm going to share exactly what I found with you right now. Before I show you the solution, I need you to understand why this happens. Because most doctors, when they look at your scan and see something that looks wrong, their instinct is, "We need to fix that." And here is what they are not telling you. After 65, your body responds to surgery in a completely different way than it did at 45. And I am not talking about getting older in some vague sense. I am talking about 6 specific, measurable failures that happen inside your body during and after any major surgery. Here is the first one. When you go under general anesthesia, the chemical gases used, they interact with the aging brain in a toxic way. They speed up the buildup of the exact same proteins linked to Alzheimer's disease. And your blood-brain barrier, think of it as the fortress wall that normally keeps inflammation out of your brain, becomes leaky. Inflammation floods in. A published study from Anesthesiology magazine, following over 1,000 patients, found that 41% of seniors over 60 had measurable cognitive decline within 1 week of surgery. I want you to hear that again. 41% in just 1 week. That condition has a name: post-operative cognitive dysfunction. Post-operative cognitive dysfunction. And your surgeon may never once mention it. Here is failure number 2, and this one shocks even my medical colleagues. When you spend 10 days recovering in bed after surgery, your body loses approximately 1 kilogram, over 2 pounds of leg muscle mass. I want you to hear that again. 2 pounds of muscle in 10 days. In a young person, that muscle comes back, but after 70, that muscle may never fully return. The surgery was called a success, and you came home weaker than when you went in. Now, here's the metaphor I always use with my patients, and I need you to picture this clearly. Operating on a younger body is like renovating a 10-year-old house. You open the wall, swap the pipe, close it back up. Done by Friday. But operating on a body that's been lived in for 70 years, That is like remodeling a 100-year-old house. The moment you open one wall, you find brittle wiring, crumbling plaster, lead pipes, a foundation that shifts when you move a single beam. You came to fix one room, and 3 others start falling apart. And the repair crew, your immune system, your muscles, your brain, is smaller and slower than it used to be. Now, I'm not just saying this. The most respected medical journal in the world has been saying this for over 20 years. And what they found changed everything I thought I knew about surgery. A landmark study, published in the New England Journal of Medicine, took patients scheduled for arthroscopic knee surgery that is performed hundreds of thousands of times every year on seniors in this country. They divided patients into 2 groups. One group got real surgery. The other group got fake surgery. The surgeon made a tiny cut in the skin, walked around the operating room for a few minutes, and stitched it back up. The patient never knew the difference. At the end of 2 years, the patients who got the fake surgery did just as well as the patients who got the real one. I want you to hear that again. Just as well. And it doesn't stop there. The COURAGE trial, published in the New England Journal of Medicine in 2007, followed over 2,200 patients with stable heart disease for nearly 5 years. Half received cardiac stents, an expensive, invasive procedure. The other half, medications only. The stent group had the exact same rate of heart attacks and death as the medication group. And the ischemia trial in 2020, over 5,000 patients, 37 countries, confirmed it again. So here is the extraordinary news. For almost every one of these conditions, the knee pain, the back pain, the hip stiffness, the research shows there are protocols that match or beat surgical outcomes. And you can start them today from your chair with no equipment whatsoever. These are the same exercises I gave to Harold, the same ones that eventually got him back into that woodworking shop. Let me walk you through them right now. This one is my absolute favorite for knee and back pain. Here's how you do it. Sit tall in a firm chair, feet flat on the floor, hip width apart, hands resting gently on your thighs. Now, breathe in slowly. As you breathe out, slowly straighten one knee, lifting your foot until that leg is nearly straight. Not locked, just nearly straight. Now flex your foot. Pull your toes back toward you and hold for 2 to 3 seconds. Then lower your foot slowly over 3 full counts. That's 1 rep, 10 on each side, 2 to 3 sets. Here is exactly what you will feel inside your body within the first few reps. A warm, working tightness in the front of your thigh. That is your quadriceps, the muscle that literally holds your knee together, finally waking up. This is the muscle that weakness causes most knee pain, most back instability, and most falls. And this is the muscle that no surgeon can rebuild for you. Safety note, if you feel a sharp pain inside the knee joint, stop immediately and check with your physical therapist. A mild ache in the thigh muscle, that is expected. That is progress. Easier variation. Sit with a rolled bath towel about 6 inches or 15 centimeters thick under the knee. Just lift the heel a few inches. Equally effective. This one was validated in a registry of over 10,000 patients. It looks simple, don't be fooled. Sit on the front third of your chair, feet flat, just slightly behind your knees. Now, lean your chest forward, nose over your toes, and press through your heels as you slowly rise to standing. Squeeze your glutes at the very top. Hold 1 second, then sit back down over 3 full counts, slowly, in control. That's 1 rep. Do as many as you can with good form in 30 seconds. Rest 1 minute, then repeat. You will feel the work in your thighs and your buttocks. Your breathing will deepen slightly. That is your body getting stronger. That is what replaces the surgeon's table. If this is too hard, raise the seat with a firm pillow. Hold lightly onto a counter with 1 finger. Start with just 5 reps and build from there. Before we continue, I want to give you something from your kitchen. Here is what you need. 1 cup, That's 240 milliliters of whole milk or oat milk or soy milk. Half a teaspoon of ground turmeric. A generous pinch of black pepper, and I'll explain in a moment why that pinch of pepper is more important than the turmeric itself. A quarter teaspoon of cinnamon, and half a teaspoon of coconut oil or ghee. Whisk everything together cold. Then warm slowly over medium-low heat, steam rising but never boiling, about 4 to 5 minutes. Add a teaspoon of honey if you'd like. Pour into your favorite mug. Here is why this works. Curcumin, the active compound inside turmeric, blocks the exact same inflammatory pathways that ibuprofen blocks, at the cellular level. And a clinical trial found curcumin was non-inferior to ibuprofen over 4 weeks for knee pain, with fewer side effects on your gut and your kidneys. The black pepper? It increases your body's ability to absorb curcumin by up to 2,000%. Not 200, 2,000. But if you take warfarin, blood thinners, or diabetes medications, please speak with your physician first. Turmeric enhances the effect of blood thinners, and it can lower blood sugar. This is powerful. Treat it that way. And always stop at least 2 weeks before any scheduled surgery. Now, this is my favorite part. These are the 3 exercises you'll do tonight, right in your bed, right before you close your eyes. They're gentle, they're calming, and they will signal your nervous system to shift out of pain mode and into repair mode. Lie on your back, knees bent, feet flat on the mattress. Breathe in. As you breathe out, draw one knee slowly toward your chest. Hold behind the thigh, never the kneecap. Now bring your other knee to meet it. Hold for 20 to 30 seconds. Breathe slowly and deeply. You will feel your lower spine gently lengthening, like someone finally taking the weight off a compressed spring. That is your intervertebral discs decompressing. 3 to 5 slow holds. Safety note, if you have had a recent total hip replacement, skip this one. Your surgeon gave you hip flexion restrictions. Follow those exactly. Same position, lying on your back, knees bent. Breathe in and let your lower back arch just slightly off the mattress. Now breathe out. Tighten your lower belly and gently press your lower back flat into the mattress. Hold 5 seconds. Release. 10 slow repetitions. This resets the deep stabilizing muscles of your spine, the ones that no surgery can rebuild for you. Think of it as rebooting the software that holds your whole back together. Last one. And this one is pure medicine. One hand on your chest. One hand on your belly, just below your ribs. Breathe in through your nose, 4 slow counts. Belly hand rises, chest hand stays perfectly still. Now breathe out through barely parted lips, 6 slow counts. Belly falls. 10 rounds like that. You will feel your heart rate slow. Your jaw will soften. Your shoulders will drop. And your pain, I mean this, will physically recede. Because deep, slow breathing directly downregulates the nervous system's alarm response. It tells your brain, we are safe, we can rest, we can heal. When you do this right before sleep, your body will spend the night repairing, not reacting. Now, knowing my own dad, I know exactly what some of you are thinking right now. So let me answer the 3 questions I hear most. First, Dr. Sarah, what if my surgeon already told me I need this surgery immediately? Here is what I want you to do. Ask one question, just one. Ask, what happens if I try 6 weeks of physical therapy first? If the answer is nothing would change, that is a green light to try conservative care first. True emergencies, an active heart attack, a bone fracture, true nerve compression causing weakness, those require immediate care. But stable pain, stable angina, disc pain, knee arthritis, those are almost never emergencies. You have time to think. Second, what if I've already had the surgery? Is it too late for me? Harold asked me that exact question. And my answer was the same one I'll give you now. No, it is never too late. The exercises I just showed you, the golden milk, they work whether you've had surgery or not. Your muscles can still be rebuilt. Your inflammation can still be quieted. You are not defined by what happened on that operating table. Third, what if I'm in too much pain to exercise at all? Start with just the 4 to 6 breath, just 1 minute lying in bed. Pain researchers now know that slow diaphragmatic breathing alone measurably reduces the nervous system's amplification of pain signals. Start there. Then, when you're ready, add just 1 repetition of the long arc lift. Just 1. Progress is progress, no matter how small. And I want to be completely transparent with you right now. I am a doctor, but I am not your doctor in this video. These protocols are powerful, and I've seen them work on my own family and on hundreds of patients. But they do not replace your personal medical care. Please, always talk to your physician before starting anything new. And whatever you do, never stop your medication suddenly without your doctor's guidance. Okay, before I let you go, there is one thing I desperately need to warn you about. This is the mistake that will undo everything I just taught you, and I promise you, almost every single person watching this right now is either already making it or is about to. It is this: going back to the same surgeon or to a surgeon in the same practice for a so-called second opinion. Surgeons, and I say this with deep respect for my colleagues, are trained to operate. That is their gift. That is their passion. And in our current medical system, operating is also how they get paid. I am not calling them dishonest. I am saying that the human brain in any profession has a blind spot toward the solution it knows best. So when you go back to a surgeon to ask whether you need surgery, you are asking a carpenter whether you need a nail. Here is the proof. A modern review of spine surgery second opinions found that 3 out of 4 patients who received a truly independent second opinion from a physician who was not performing the surgery were told conservative care first. 3 out of 4. No knife, no anesthesia, no recovery room. And here is the part that breaks my heart, because most seniors have absolutely no idea this exists. Medicare Part B covers the full cost of a second surgical opinion, 80% of the fee with no referral required for any non-emergency surgery. You do not need your doctor's permission. You do not need to ask anyone. Just call 1-800-MEDICARE or go to medicare.gov and ask for a second opinion from a non-surgical specialist, a physiatrist for your spine, a rheumatologist for your joints, a non-interventional cardiologist for your heart, someone who has no financial reason to say yes to a procedure. That one phone call might be the most important call you make this entire year. So remember, question any elective surgery recommendation before you sign that consent form. Try conservative care first and make that one call to Medicare for your free, independent second opinion. Start tonight. Your body and your family will thank you by morning. Now, if you want to know how to rebuild your joints from the inside out so that no surgeon ever has that conversation with you again, I put together something incredibly important right here on your screen. I'll see you there.